to this video. I'm going to show you different phlebotomy equipment, okay, that you might use if you're new. This is gonna give you a heads up and you're gonna get ahead of the game, because once you are in class you will know exactly. When they show you, you'll be like, ooh, I know what that is. All right, so here we go. We're gonna go ahead and get started with the needles first. Okay, we have right here a 21 gauge. We have the 23. Okay, these are the most common ones. So I have a quick pop quiz. Which needle is bigger? You see how this one says 23, this one says 21. This is a question you might get on your exam for your license, so you better get it right. I'm just kidding. You're lucky because I'm gonna give you the answer. The bigger the number, the smaller the needle. I know that's very confusing, but this one's the 21 gauge, so it's bigger. It's not even that big in my opinion, but if you could look, this looks tinier. Okay, this one looks bigger. See? So the bigger the number, the smaller the needle. So these are the most common ones that people love. They're the butterflies. Okay, we have this one, it's the 22, and this is the 21 gauge. Okay, of course we have a hub. Okay, in order to draw, you can use either of these needles. Okay, and of course you need your tourniquet. All right, you have your tape or your cold band, it's up to you, and you need your alcohol pad. Okay, there you go. And also can you guess what you're missing? Your gauze. Okay, also you need to know what to order depending on the test. Do not stress too much about this, but if you do watch my order a draw chart, if you master that, as soon as you see a test, you'll know. Okay, if the order is CBC, lavender. Okay, CBC, lavender. If they order any type of chemistry test, most likely this is the outpatient area, so for all chemistries, most of them, it will be gold top. Okay, which is this one. This one is SST as well. These are called gold tops, SST. It's just that this one's called it, you know, gold top because it looks gold, but this is exactly the same thing. It's just a lot bigger. Don't get confused this one with the red top. Okay, anyhow, so if they order a ProTime INR, or if they order PPT, which one is it? Pop quiz. Your answer is this one. Okay, so if they order a lead, and what will you draw if it order a lead? Normally that's a send out, and your answer is this one, the tan. This is for lead. Okay, of course everywhere you work it may be different, so make sure you follow their rules, because some places that I worked before, this is for ammonia, but some places it's the green top for some reason. But you always go by what the facility that you work at. Okay, follow their rules. But for the most part, chemistry tests are SSTs. Okay, any chemistry, I'm talking about lipid panel, the comprehensive metabolic panel, which is the CMP, basic metabolic panel, which is a BMP. If they order the BN as a Nancy, BNP, which tube is it? Okay, pop quiz. Your answer is this one. Okay, so you draw it, and this is the only tube that will get rejected if it's clotted. Okay, so for CBC, it's whole blood. That means that as soon as you draw, invert it so it doesn't get any clots, you take it to hematology department. Okay, but if it's the BNP, it's also lavender, but you spin it down. Okay, because you will get plasma out of it. And for the BNP, which is the BN as in Nancy, it will be the lavender. They want plasma. Okay, for CBC, they want whole blood. Whole blood means that as soon as you draw, invert it, and then you take it to the department, they test it whole blood. That means that you do not put it in the centrifuge, okay? These usually need to be clotted for at least 30 minutes. But once the blood is in there, what I like to do is go like this. If the blood does not move, like you could tell it's clotted, then you can spin it down. All right, so what else do we have here? You might come across blood cultures. All workplaces, they look a little bit different, but what you need to know is that one is aerobic and then the other one is anaerobic. Aerobic, air, anaerobic, no air, okay? So let's go ahead and assemble these needles so you can have an idea how they look assembled. Of course, something that you can never forget is your gloves, okay? So these are butterflies. You could also attach this. You could use a syringe as well, okay, with these. But I'm going to show you the different forms. I'm going to use this one with the syringe. So you normally want to open everything in front of the patient because that way they know it's brand new, okay? But if your butterflies, some butterflies come like exactly like this, but without this, okay? This is great because you can either put it on the hub like this and draw, okay? So you poke, okay? If you have a good placement, you can let go of the butterfly. That's what's cool about the butterfly. I still like to do it like this. I grab it like that, your bevel up, always, okay? As you can see, oh, I guess you can't see. All needles have a bevel and they always has to be facing up, which it's really hard to see. But anyways, once you poke, you have a good placement, you can let go of the butterfly. It stays in place. And once you let go of it, then you can easily put the tubes in. Okay, you let it do this thing, remove it, put the next one. All right, so this is one form. But if you want to attach the butterfly and your butterflies come with this, you remove this, okay? And you could always attach a syringe, okay? So let's do that. All right, so you have your butterfly attached to a syringe. Before you draw, try to go like this, okay, like this, and push it back, because that will give you, once you're in the needle again, once you're in the vein, you draw, let go of the needle will stay most likely, and then now you have full control of grabbing the blood, and you always do it in a slow motion, okay? You never go like this to draw blood, never, okay? Once the needle is in, you go slowly. That's why butterflies are the best, because they stay in place once they're inside the needle. But sometimes you might see that once you're inside the vein, the butterfly, when you let go of them, they flip. Don't panic, grab it, try to place it the right way again, and then, or sometimes just hold on to one wing, and then you could go like this, okay? Obviously, once you have blood in here, never go back inside like that, okay? It's only at the beginning, because the syringes are hard. You feel it like it has a little hard thing. So if you forget to do that, when you pull, it's gonna be super hard to do it. So you go like this. That way, when you're in the vein, there's blood here, and it will flow so easily, so smooth, and you'll be done, okay? So that's one form. Another form is to simply open your butterfly and attach the butterfly like that. And again, once you insert the needle, you could always let go of it, okay? Let's pretend that this is obviously inside the vein, and you could easily get your tubes in and out as fast as you possibly can, and you're good. So that's another form of drawing. Another form of drawing, of course, is, let me show you, the straight needle. Okay, a lot of people don't like the straight needle because it seems like you really have to be like careful because you don't want to move. Okay, once you remove this, you poke and you can't move this. You have to be very, very good at not moving. Okay, but what I like about this is that when you put the needle in and it's successful, you put the tips in here and it will get filled so much faster and you'll be done in and out super fast. Okay, I normally use this one if I see that it's a super good juicy vein. Okay, and then to lock it, it's really simple. Always remember to go like this on the same place where you're at. Usually I use this. I go like this. Lock it, pop, lock. Okay, and then always remember to put your sharps here. Okay, always this. We'll get it tested for that. This is trash. Okay, anything with a needle goes in your sharps container. All of this trash. You don't put this in here. Okay, this, where does it go? To trash? No, it goes in your biohazard. There you go. If you work at a hospital and you just come in with your supplies like this, you know, like this, you grab your alcohol, this will do. Okay, when I was new, I really wanted to go in like this inside the room. That's not necessary. Okay, all you need is 1 or 2 gauze and you will be good. I sometimes take 2. I take inside 2 because what if you drop 1, you already have 1 there. So you go like that, you go inside the room like that. What I like to do with the tape, so you don't carry the whole tape and all that, you'll see that a lot of phlebotomists grab their tape before they go in the room. I normally go like this, I go like that, so you put it on your glove. So when you draw, you have it right there. You don't have to worry about your tape, and you go like this, tape it. Okay, some people put it like on like that. It's up to you, but I normally put it on my glove and do the blood draw. Once I remove the tourniquet, pull it out, and then you could easily do that. And then what else? All right, so let's pretend that you have blood in the syringe. Okay, this is full of blood. Let's pretend that it's full of blood like that. You remove this. Okay, the safe way to transfer this to the tube, you have a transfer device. Okay, it looks like this. That's a little thing. Everywhere I work, it looks exactly the same, so most likely you'll see it like that. And this is so cool. Obviously it has no blood in it, but when you insert the tube, you see how it goes like that? It will get filled with blood. And maybe you could put it on the next one. It will do it for you. And then you throw all this away in the sharps container. Where's the sharps container? Where is it? Oh, right here. There you go. It's so much fun, you guys. I love drawing. I just love it. I love poking people. It's so much fun. Of course it's fun now because I think it's pretty easy now, but of course at the beginning it could be a little bit tricky and scary and all that, but that's all normal. Okay, that's all normal. Do not give up. You will love it, and you're just not gonna be able to, you're not gonna regret it. I don't think so. Okay, you can always do more as a phlebotomist because a lot of people become nurses, x-ray techs, even, what is it called? There's another position that they do. What are they called? Oh, the respiratory technician. Those are the ones who do the ABGs, which is draw from the actual artery, and they get paid very well. Okay, you could always do more. I have met couple of doctors who told me that they were phlebotomists first. Isn't that awesome? And then once you are a phlebotomist, if you do want to be a nurse, you're going to be the expert of doing IVs, because a lot of nurses they struggle with IVs, of course, because it's so hard. But if you're a phlebotomist, you're going to be a pro of doing, IVs, because you already know, and it's just so cool. So something that phlebotomists don't really like, since I'm talking about nurses, I love nurses, okay, because we help each other and everything, but phlebotomists don't like it when the nurses call us for simple questions. But of course, we're the phlebotomists, we're the pros, there are nurses who have to draw, because not all patients we have to draw, okay? They have a central line or a pick line or whatnot, so the nurse has to draw, and they call the lab, and they always ask us, like, what tube do I draw for a CBC? Lavender. What tube do you draw for a pro time? And then for us, it feels like dumb questions. That's not nice to say, because there's no such thing as a dumb question, but there are some phlebotomists that hate it when the nurse calls, because they get paid more or whatnot. But honestly, I love talking to them. That's okay. I'll help you. So another thing is that nurses sometimes get this tube. This is the only tube that cannot be short sample. There's a invisible line right here. I don't know if you can see it. Can you see it? It's right here. This tube has to be up to right here, up to this line. If it's below, rejected.